Welcome to the Central East Lynn Regional Cardiovascular Rehabilitation Service. My name is Dr. Joseph Ricci. I'm the Medical Director of the Regional Cardiac Care Program here at Rouge Valley Health System. It's my pleasure today to introduce you to the Cardiovascular Rehabilitation Service of the Central East Lynn. Cardiovascular rehabilitation can speed your recovery after a vascular event. Whether you've had a heart attack, angina, stroke, bypass for the legs, coronary bypass, all of these conditions have a recovery period. When you participate in cardiovascular rehabilitation, you can expect that your recovery will be faster, more robust, and that you return to family, friends, and work feeling better and stronger and more able to return to a normal lifestyle. Cardiac rehabilitation is very effective. We know that cardiac rehabilitation lowers your chance of dying from a future heart event like a heart attack. It reduces your future risk of stroke or complications from cardiac disease. It reduces your chance of being admitted to hospital or visiting emergency departments or having to see your family physician or a specialist for an unplanned event. Cardiac rehabilitation, because it has a significant impact upon your health, should lessen the chance of you having future cardiac problems. Additionally, cardiac rehabilitation can lower your risk factors. Risk factors like diabetes, high blood pressure, cholesterol, being overweight, all of these things can be substantially improved through the program you're going to participate in. By being more active and participating in this program, the sedentary lifestyle that can increase your risk will be reduced. Your physical fitness and ability to enjoy life and partake in the activities of daily living you really enjoy will be enhanced. Cardiovascular rehabilitation is part of the standard of care for the care of patients with cardiovascular disease. Canadian guidelines and international guidelines emphasize that effective cardiovascular rehabilitation is a standard of care for all patients with vascular disease. A program like this is essential to your recovery and your long-term health. Every patient with cardiovascular disease should be afforded the opportunity to participate in a program like this. And for this reason, we welcome you to this program and hope you benefit from this in the way we are sure you will. We have a remarkable team of specialists providing cardiovascular rehabilitation services for you. Our team consists of nurses, physiotherapists, exercise specialists, dietitians, and pharmacists. We have a large group of volunteers who are passionate about assisting you in your experience at cardiovascular rehabilitation and have been part of our service since its inception more than 25 years ago. Our volunteers are, in fact, the lifeblood of the program. Volunteers are people just like yourself who've had cardiovascular issues before and have participated in the program and feel so strongly about the benefit to you and to the community that this is their way to give back and be part of your recovery.
And I own this program to where I am today. I come back, I volunteer here, I give back to this program because I don't know where I would be if it was not for the rehab class and for the therapists and for the doctors here. When I first come into the program, where I was at that particular time in my life, you wouldn't recognize me. The anxiety, I lost over 30 pounds, all the different issues that were going on. Am I going to get better? By coming into the program, having a therapist work with me, monitoring me, give me my baby steps that I can get around the track at least one time and in so many minutes, that I did not die when I went around the track. Then after, I was able to go a lot longer, a lot further. So it took me a while to build up, number one, that confidence that I am going to get better. And once I got a handle on that, with the therapist monitoring you all the time, then you go back for your intake for your fitness level when you first come into the program. 3 months later, you do another test to see where your level is at that particular time. And when you see a marked improvement, that in itself encourages you. And then after, when you leave, you're going to be another improvement that you say, I can do these things, and it gets rid of that fear. It gets rid of that anxiety. It gets rid of those hurdles that I can get better if I stay with the program. I'm back to right now to where I was when I was 20 years old. It's taken me a long time to get back to that stage health-wise to where I was when I was a lot younger. And it's just by going through some of the issues. I wish I hadn't gone through them, but I'm so fortunate I did because I've come out much stronger and much better as a result of it.
On your first visit, you'll meet our expert team. They'll review your current situation, your recent experiences, and create a plan for you to guide your next 6 months with us. The goal of that plan is to find a specialized approach that suits your needs so that at the end of this service and our time with you, you benefit from this to the greatest extent possible. Let's talk about each of the sessions that you attend each week. As I mentioned, you'll come to the Cardiovascular Rehabilitation Service on a weekly basis for 3 months and then monthly for 3 months. The program in its entirety is 6 months in duration. Each week you'll participate in an education program we've designed for you to better understand what cardiovascular disease is, to better understand how you can reduce your risk for future cardiac events, to better understand how to live with cardiovascular disease and have the best quality of life you can. That education program includes specialized lectures and group discussions with pharmacists, dietitians, nurses, and our exercise physiologists. We cover topics as simple as how to exercise in cold weather and as important as to how to take your medication for the best benefit. If you see your family physician or specialist in an office and have a condition that would benefit from cardiovascular rehabilitation, all your physician has to do is fill in a standard referral form and send it to us. We'll do the rest. One of our staff members will take that referral. Within 24 to 48 hours, you'll receive a phone call, and within 1 to 4 weeks, you'll start with us. You'll begin your first intake with one of our expert staff and be introduced to our team within a month's time. For cardiovascular rehabilitation to be effective, it has to be practical. It has to be close enough to home that you can get there comfortably, still having time for your normal daily activities, which may include time with family and work. We know that if cardiovascular rehabilitation is more than 30 minutes from your home, that participation rates fall. We've worked really hard to ensure that you have access to a facility like this close to home anywhere in the Central East Lynn. As of today, we have sites in Scarborough, Ajax, Pickering, Whitby, Oshawa, Port Perry, Lindsay, and Cobourg. For us and for you, success is to complete the program healthier, fitter, and with a better understanding of heart disease. Success is to leave the program and be empowered to continue the lifestyle changes you've learned here and to use what you've learned about cardiovascular disease to lower your risk for future events. Our team is here to make sure that you have the best experience possible.